How to manage post-op nausea after surgery. Imagine waking up after surgery feeling sick and uncomfortable. That feeling can slow down your recovery and make healing more difficult. But there are ways to help you feel better faster. First, understanding what causes post-operative nausea and vomiting is important. It often happens within the first 2 days after surgery. Factors like the type of surgery, anesthesia used, and your personal history can increase the risk. Women, people with motion sickness, or those who have had nausea after previous surgeries are more prone. Using opioids for pain control can also make nausea worse. To prevent nausea, your medical team might change how they give anesthesia. For example, they may avoid certain gases and use medications like propofol instead. Staying well hydrated during and after surgery also helps. Drinking small sips of water or clear fluids as soon as your doctor says it's okay can make a difference. Doctors often give anti-nausea medicines before or during surgery if you're at higher risk. These medications include drugs like ondansetron, dexamethasone, and droperidol. Using 2 or more different types can be more effective. If nausea happens despite these precautions, rescue medicines such as promethazine or additional doses of ondansetron can help. It's best not to repeat certain drugs too soon to avoid side effects. Pain control is another key factor. Opioids can increase nausea, so your doctor might suggest combining non-opioid pain relievers like acetaminophen and non-steroidal anti-inflammatory drugs. This approach reduces the amount of opioids needed, lowering nausea chances. Diet plays a role too. When allowed, start with small sips of clear fluids like water or broth. As tolerated, move on to bland foods such as toast, rice, or bananas. Avoid greasy, spicy, or heavy foods initially as they can trigger nausea. Eating small meals frequently instead of large ones helps your stomach adjust better. Some people find relief with non-drug methods like acupressure at the P6 point on the wrist. Applying gentle pressure there can reduce feelings of nausea. Additionally, keeping the room well ventilated and avoiding strong smells can help. If you feel nauseous, sitting up or taking slow, deep breaths can also make you more comfortable. Managing post-operative nausea is a combination of prevention, early treatment, and supportive care. By working with your healthcare team, adjusting medications, and following dietary guidelines, you can reduce discomfort and support your healing process. Remember, feeling better faster means you can focus on getting back to your normal activities sooner.